Often you see it. Many times it's not so in your face, just like today. It leaves your eyes red and watery. Sometimes they even burn. Often it gives you a headache. Sometimes you feel nothing. Why? Probably you're just used to it. We have normalized dirty air. We have normalized breathing in filthy, toxic. And not just in Delhi where I am right now. In many other cities and towns of India, we are knowingly, unknowingly breathing poison, bad air, and accepting this kind of bad air, breathing this kind of bad air has now been normalized. This time around, Health 360 is putting the spotlight on air pollution once again. And we are telling you about the new perils of smog. This in collaboration with the India Today magazine. I'm Sneha Mordani. What exactly is pollution? Is it the smoke that you see, or is it often not visible to the naked eye? What is particulate matter 10 and particulate matter 2.5, which actually is just so tiny, 30 times tinier than a normal human hair strand. It gets into your bloodstreams and reaches all your organs. This report is going to tell you all about what pollutants are.
The recurring blanket of poisonous haze, a pre-winter phenomena, has become an annual event with many having to resort to investing in expensive air purifying equipment and even staying indoors. A spate of new research is showing the insidious effects of pollution on health, which manifests as sore throat, cough, cold, watery eyes, and tightness in the chest. The impact of pollution could even snowball into deadly ailments like COPD, cancer, renal, and cardiovascular diseases. The paranoia around these ailments requires demystification of pollution to take better protective measures. So, what is pollution? Pollution is a product of toxic materials entering the environment. Nowadays, pollution is mainly caused by highly concentrated mix of gases like carbon monoxide, nitrogen oxide, sulfur dioxide, and hydrocarbons. These gases are mainly contributed through vehicles, factories, crop burning and fossil fuel burnings. When these gases react with sunlight, they form smog, which is a thick fog or haze. But one of the most menacing pollutants is one that is not necessarily visible to the naked eyes. It is known as particulate matter. There are different types of particulate matter which vary in size, shape and chemical composition. They are defined by their diameter for air quality regulatory purposes. Most of the particulate matter includes dust from construction sites, landfills and agricultural activities, wildfires and waste burning, industrial sources, wind-blown dust from open lands, pollen and fragments of bacteria. Pollutants other than particulate matter are the lesser evil and can adversely affect young children, the elderly and those with weakened immune systems or respiratory ailments. But Particulate matter can even affect healthy individuals. Based on the size, particulate matter is often divided into two groups. The first is PM10, which contains particles with sizes ranging from 2.5 to 10 micrometers. The other fraction contains PM2.5, which is 2.5 micrometers in diameter. To put it into perspective, PM2.5 is 30 times thinner than a strand of hair, which on average is 70 micrometers. It is invisible to the naked eye, and since it is microscopically small, it can penetrate the lungs. Most of the total mass of airborne particulate matter is usually made up of fine particles ranging from 0.1 to 2.5 micrometers, which is why they pose such a huge health risk.
Apart from the involvement of the lungs, which would include as development of asthma, COPD, allergies, infections like tuberculosis, and even people during COVID who were exposed to poor air quality had greater symptoms and had greater likelihood of developing COVID infection because of the air pollution. So lung cancer, then there's a new entity which has been found. This is called hypersensitivity pneumonitis, which is also being associated with air pollution now. So these are the pulmonary complications in the adults. Then there can be the non-pulmonary complications, which would include acute heart attacks, atrial fibrillation or arrhythmias, brain strokes, premature deaths. There are studies which have shown that just by the exposure to this air pollution, we in Delhi have reduced our lifespans, average expected lifespan by 11.9 years. In children, they could develop poor lung functions, poor lung immunity. They could also develop allergies. Some children even could develop brain retardation, slow growth mentally, which is some psychosomatic disorders. All that can happen.
According to this year's Global Air Quality Life Index report released by University of Chicago, fine particulate matter will stave off 5.3 years from an average Indian's life. Those who live in Delhi have it worse, since living in the most polluted city in the country will cost them 11.9 years. In New Delhi, with Chetna Vasudevan, Bureau Report, India Today.
Let's talk about the most polluted cities in India. Delhi, the national capital, is supposed to be our pride, but puts us to shame year after year. Heavily polluted. Other metropolitan cities also, which have high vehicular pollution, are extremely polluted, like Bengaluru, Chennai for example, even Kolkata. But cities other than metropolitan cities also, like Kanpur for example, Pune surprisingly, which was otherwise always a cleaner city as compared to others, are extremely polluted now. Bharatpur too, even Dehradun. These are cities and areas which are found to have very bad air quality. At the time of filing this report, Delhi's AQI, like I just checked on my phone, was 325, which is in the severe category. It's way above the acceptable limits. But who exactly is talking about air pollution right now? As of today, no one is. It's completely vanished from our conversation. Let's just do a comparison of other major cities across the world. London, for example, also Los Angeles, New York, Seoul, Tokyo, Moscow. What's common in all of these cities? The AQI in all of these cities, as you can see in our graphics clearly, is that it's constantly around 50 or below 50, unlike New Delhi, which is at 325 right now. The concern is that there is little chatter about it. There isn't a single organ of your body that has been left unspared because of pollutants. Air pollution is in fact causing a whole range of problems. The long-term impact of air pollution simply can't be ignored. In fact, our focus this time around is on the new perils of smog. Renal failure, cardiac arrest, diabetes, dementia, Alzheimer's, reproductive issues, fertility problems. This list really is endless. If there is one health emergency that you must be extremely worried about, it is air pollution. Are your eyes watery? Or do you find it difficult to breathe in the dirty, toxic air? Or are you someone who is not affected by air pollution? At least, do you think you are not? What if we told you that this air that you're breathing could cause you cancer, or lung disease, or fail your kidneys, even if it doesn't cause you immediate discomfort?
Complications are two parts. One is the pulmonary complication related to the lungs. The other are the non-lung related complications. In the non-lung related complication, it could involve the heart, result in heart attacks, atrial fibrillation, different kinds of arrhythmias. It could result in brain strokes. It could also result in diabetes and elevated sugars, and of course premature deaths.
In recent years, the demand for air purifiers and anti-pollution masks have shot up. As many as 200 million people fear succumbing to toxic air. Inhaling this air has been equated with smoking 50 cigarettes a day. So who is worse, chain smokers or those who are living in Delhi? The latter, it seems. Air pollution is even causing diabetes.
Basically, there are these new studies which have come, which have actually shown that air pollution levels have been associated with a higher glucose level, as well as a development of a new onset diabetes. And all this happens because of an inflammatory cascade that is triggered off by this air pollution. Whenever the pollutant air goes into our lungs, goes into the bloodstream, it triggers off an inflammatory cascade. This inflammatory cascade then reaches the various organs of the body, including the brain, the heart, the kidneys, the pancreas, and there causes a lot of damage.
It affects our body organs in the most worst way. Particulate matter enters our airways first and causes an immune reaction we recognize as inflammation. This inflammation is a leading risk factor for COPD and lung cancer. It also can prematurely age our blood vessels and lead to more buildup of calcium in the arteries, a risk for stroke and heart attack. It can cause changes to heart rhythm and structure. Pollutants can impact your memory recall function as well as increase risk of Parkinson's disease by 56%. Pollution is also a risk factor for age-related macular degeneration, a leading cause of blindness. It can impair kidney function as well as damage it through chronic inflammation.
One has to realize that these particles can be so fine that they can cross the bloodstream. So the first impressions of this smog causing problems to the other organs came in 1956 when there was a London smog. London smog was by burning carbon, by automobiles and deep winters of London. To the surprise of physicians, they found that there was a high increase of heart attacks during that London smog. So that started the chapter that smog just does not affect only the lungs. There are many more organs that can be affected. And we know now that heart is the major cause of deaths due to pollution, not lungs.
There is now a growing body of evidence to link air pollution with cancer. A study led by the Harvard T.H. Chan School of Public Health in the US and published in Environmental Epidemiology in August 2023 has found that chronic exposure to fine particulate air pollutants and nitrogen dioxide raises the risk of 4 types of non-lung cancers in cancer-free older adults.
If you look at the recent studies which are available, not only the lung cancer, air pollution can lead to almost every cancer, and in the recent past we've had studies in which it has been found that these small particulates, that's called as PM 2.5, they are such fine particles that when we inhale them, they are able to go through the deeper part of the lung to the blood, and from the blood they go and settle into various organs of our body and cause cancer.
Even low levels of exposure to air pollutants are found to make people particularly susceptible to developing these cancers, in addition to breast and endometrial cancers. The full extent of deeper impact of air pollution on our health is just beginning to be acknowledged and understood. With Sabha Ikram, Bureau Report, India Today TV. Pollution is caused because of firecrackers. Northern India is polluted because of the stubble burning that happens in Punjab and Haryana. Yes, all of this is true. But is it as simple as that? It really isn't. Because it's not just Northern India that is polluted. Many parts of India have air which is in fact dirty, filthy, the quality of which is way beyond the permissible limit. In Delhi, for example, it's a unique problem. It's got the highest number of cars, vehicles, more than other metropolitan cities put together. Vehicular pollution in Delhi is a huge concern. So will you consider carpooling this week, or will you think about taking public transport to work? Are the solutions really sometimes not in our own hands? Think about construction, for example. Construction activity is making this region a huge dust bowl. It's a price that we are paying for progress, at least ostensible progress. Our report tells you all about the problem, various reasons for this, and also offers the solutions. Take a look.
Worsening air quality in Delhi NCR region has now become an annual affair, making the much-loved Delhi ki sardi a torturous affair. Gone are the days when one could feel the breath of fresh air during winters. Now, getting out in open during this time of the year is all about feeling discomfort in breathing. Do you know why is this happening? Well, the answer to this is smog. For those who are still unaware of the word, smog is derived from two words, fog and smoke. Smog is composed of nitrogen oxides, ozone, smoke and other particulates. It is due to the presence of such harmful chemicals in the air that makes air quality deteriorate. Year after year, there's chatter and more chatter around stubble burning and firecrackers during Diwali being the culprits for the poison we breathe. But there are more factors than just one. This is toxicity on the move. Vehicular emissions are the largest contributor, contributing 38% to capital's air pollution.
You would often see that people use public transport if there is a direct connectivity. And since the government has emphasized on improving the road infrastructure by providing more flyovers, expressways, tunnels and other things, so the road capacity has increased over the years. But if you look at the data on road availability for 1,000 vehicles, per 1,000 vehicle, that is reducing. That means more we are providing the road capacity, the traffic is increasing.
The number of motor vehicles on Delhi roads has increased by approximately 21 times in the past 3 decades. The number of vehicles per 1,000 population in Delhi, which was 317 in 2005-2006, has doubled to 655 by 2020-21. During winter months, when the temperature is dropping and atmospheric inversions are common, there is increase in coal and other fossil fuel usage to heat homes and buildings. It is due to these combustion emissions together with the lack of pollutant dispersion that causes smog. At COP28 Climate Summit, leaders highlighted the opportunities to phase out fossil fuels. UN Secretary General Antonio Guterres, during the summit, urged world leaders to plan for a future without fossil fuels. He said there was no other way to curb global warming, but a lot is left to be desired. this, stubble burning, practiced in North India. Punjab, UP and Haryana makes the air pollution situation worse during winter months. Pressed for time and short on funds, farmers are forced to resort to stubble burning and prepare their fields for wheat cultivation.
There is a very short window now between the time when they harvest rice or paddy and they have to start the sowing of wheat. Earlier this window used to be a good 45 to 60 days, but now this window, because of the change in agricultural practices, the change in climate, etc., this window is now only about 20 to 40 days. And there is no other measure which helps the farmer dispose of stubble as quickly as burning stubble can.
Year after year, solutions remain elusive.
Government has been extremely proactive, but a farmer is an entrepreneur. He does not understand anything except the economics of farming. If we have solutions which are viable for the farmer, which farmer can afford, there is no reason why the farmer will, burn stubble and not use some of the other alternatives. So it's very important for the farmers to know what these alternatives are, how much they cost the farmer, and what the implications are, the positive impact of these vis-a-vis burning of stubble.
But is this a problem with no solution? Certainly not, say experts.
So one is obviously trying new varieties of rice. Second is crop diversification towards horticulture. Both these are cereal crops, and because they have minimum support price, government is the ultimate buyer. Farmers have this comfort. So they grow and they know that there is a market available. But eventually there has to be diversification towards horticulture.
Every year, without fail, irrespective of financial and social status, the residents of Delhi NCR fight a common enemy. Delhi is not only one of the most polluted capitals, but also one of the most polluted cities in the world. And it's not just Delhi. The entire Indo-Gangetic Plain has been dealing with this complex problem that requires a solution to be worked on all through the year. And not just the last 3 months of the year. With Gargi Rohatgi, Sneha Mordani in New Delhi for India Today.
Thankfully, now there is just so much research, data and awareness around air pollution. Think about it. Just a few years or so ago, there was little conversation about air pollution. The thing here is that the problem is omnipresent. It's not just Delhi city. For example, the neighboring Bharatpur in Rajasthan, which boasts of a big, beautiful bird sanctuary, sometimes has got air dirtier than Delhi even. Even Mumbai, for example, which had the advantage of being proximate to the sea, got the most polluted air this year. It reported the worst AQI levels this year. Several regions, towns, cities are unspared essentially. Like I said, the problem is omnipresent. And that's the reason why Health 360 and India Today is continuously putting the focus on air pollution. Not just the problems, but also the solutions. We hope you enjoyed watching the show as much as we did, putting it together for you. You can catch these reports and much more going up on our website too. That's indiatoday.in. You can also download the India Today app. All of these reports are also found on India Today's social media accounts, which is YouTube, Facebook, Instagram and Twitter. Thank you so much for watching. Take very good care of yourself. Bye for now.